Dr. John Torres here with NBC News on this Facebook Live to give you some updates on coronavirus, particularly what happened over the weekend, last few days, just to get through those headlines and get a better explanation of what those headlines might mean, and then answer some questions you might have. So please go ahead and forward us your questions. We're going to try to get to as many of those as we can. Well, a couple of things over the weekend that came to the news front, and just to let you know, one of them is called pediatric multi-system inflammatory syndrome. And you might have heard about that over the last 4 or 5 days, but essentially what's happening is we're finding children, particularly 2 to 15 years old, that are suffering from this syndrome called PMIS, pediatric multi-system inflammatory syndrome. And what's happening here is they're getting hospitalized. They're particularly having issues with their hearts and their kidneys because we think of coronavirus. The reason we're saying we think of coronavirus is because most of these cases are the patient has either coronavirus tested positive or has tested positive for antibodies due to coronavirus. But not all of them, and that's what makes this a little bit confusing. Now, it's a syndrome that represents or that resembles something called Kawasaki syndrome or Kawasaki disease, which is pretty rare in the country, about 3,000 cases a year. That happens in children as well. And that's a disease where the child gets a virus, they recover from the virus, and later on their body starts developing these issues. We think it's a type of thing where their immune system kind of goes into overdrive, causes an inflammatory issue that then attacks part of their heart, their kidneys, other organs. Well, this one's similar to that because it also attacks part of their heart, their kidneys, and other organs, but it hits a different part of their heart. With Kawasaki's, it actually hits their coronary arteries. These are the arteries around the heart that supply blood to the heart, and the aorta, which is the big blood vessel that comes out of the heart. They can develop what's called an aortic aneurysm from this. With this disease, with the PMIS, or the syndrome, this, instead of attacking the coronary arteries, is actually attacking the muscle of the heart and can result in heart failure. Last week I actually interviewed a mom and a 12-year-old. The 12-year-old had cardiac arrest because of this. Luckily they were able to do CPR, give her some medication, and bring her out of that cardiac arrest. It lasted about 2 minutes. She's doing fine right now and recovering, and they think it'll be a full recovery, which is what's happened to most of these children. Now, the big majority of these children so far have been in New York State. They think around 80 plus in New York State have this. Around the world, they think a couple hundred might have this. So it's very rare. It doesn't happen very often. But one of the reasons that we're hearing more about this is because more attention is being paid to it. They're actually putting out bulletins. New York State just put out a bulletin saying, hey, physicians, look for this. If you see this, report this to the Public Health Department in New York. Other states are doing the same thing. So as before, these onesies, twosies type patients where doctors were seeing them, kind of scratching their heads. What is this new syndrome? What do I do with it? Well, now they're all putting their collective thinking together, and so it's getting reported more and being paid more attention to. So you are going to see numbers going up. Again, it's very rare, just a couple hundred cases out of the million plus cases that are happening, but something that can be very, very scary for parents in particular. Here's the things to look for, and here's the warning signs that we found out happen with this. Number 1, fevers of greater than 5 days in duration. So these are prolonged fevers. Number 2, severe abdominal pain, diarrhea, or vomiting. The weird thing too is they have this rash. It's more of a mottling blue or pale discoloration to their skin, rapid breathing, chest pain. These are signs that something could be happening along with lethargy or confusion. If you notice these, then seek medical help immediately because it's something that could be turning very quickly and going from sort of them feeling sick to them being in danger of having a lot of issues going on. So something that can happen. There are no treatments at this point. Supportive care mainly. They are trying a few things like IVIG and some other things to try and help out. But to this point, it's such a new syndrome and such a new issue, we don't know how to treat it. But they're learning more and more, and hopefully not that many kids are affected. But in case you hear about this, that's what we're talking about. The second thing is a study just came out of Johns Hopkins, and it kind of piggybacks a study that came out of China a month ago about our eyes and how our eyes are actually a pathway for the coronavirus to get into our body. The eyes in this new study, they looked at eyes from people they were doing autopsies on. These were not coronavirus patients. These were patients that died from other causes. They were doing autopsies. They looked at samples of their eyes from that and from surgeries, so they had eye tissue left over, and they found out they have a receptor called an ACE2 receptor. It gets a bit sciencey here, but it's ACE2 receptors are similar to receptors we have in our kidneys, and these are receptors that the coronavirus, the SARS-CoV-2 virus, actually likes to attach to. And so the more of these receptors you have, the thinking is, the more likely it is that once the virus gets to you, it can get into your body. Well, they found these in the eye as well, the coverings of the eye. And so the big important message here is not only do we have to cover our face, but we also have to make sure we cover our eyes if we're not doing that social distancing. Because if somebody's coughing or sneezing, then theoretically that could get in your eye, and from your eye get into your body. But this is something that myself and a lot of other experts have talked about since the beginning, since January, that the way that gets in there is through your mouth, your nose, or your eyes, so you have to protect all three things. We mainly talk about masks, but also think about eyes, especially if you're in an environment where people are coughing or sneezing and you can't do that social distancing. If you look at healthcare officials, if you look at people in hospital settings or EMS settings, you'll notice that they wear full face shields. That's to protect the eyes as well, because we know from other viruses it can get into your eyes. It made sense this could too, and it turns out indeed that is the issue and what's going on. So a couple things. One, the pediatric multi-system inflammatory syndrome. It's rare, but it can be very scary for patients. I'll go over those symptoms again to look for. Fevers of greater than 5 days, severe abdominal pain, diarrhea, vomiting, mottling, blueness or paleness to the skin, rapid heart rate, rapid breathing, confusion, or lethargy. Those are the signs to look out for. If you notice those, get your child checked out immediately. On top of that, eyes, we now know, could be a conduit for getting the coronavirus into your body. So make sure you protect your eyes as well. And that's another reason to make sure we wash our hands for 20 seconds before we touch our face, because you touch your eyes, it's an easy way to get in. Let me see if we have any questions here that I can answer about coronavirus in particular, because you guys actually have the greatest questions.
My daughter has COVID-19, but 3 kids at home. What do you do if you're by yourself and you're raising your kids and you're sick?
So the question is, if I'm sick and I'm raising my kids, what do I do to raise them if I have coronavirus? And let me go through a couple scenarios. Everybody has coronavirus. Well, that's a scenario of whoever is most able to take care of everybody else, because everybody already has coronavirus. That makes it a little bit easier, but not something we want somebody to have happen to them. If, on the other hand, the parent has coronavirus and the kids don't, that makes it a little trickier, because once you have coronavirus, if you test positive for it, then you want to go ahead and isolate yourself. Isolate means staying away from everybody else. That's hard to do if you're raising kids as well. In an ideal world, you have somebody who can help you, somebody that can take the kids for a couple weeks while you recover from it. But that's not everybody's case. And so essentially, if you do have to take care of children, the one thing you want to make sure you do is you put on a mask, you wash your hands before you do anything with the children, wash your hands afterwards, and every time you come in contact with them, make sure that you're taking care of yourself. That's the best thing you can do at this point. Plus, if you're using the same bathroom, clean the bathroom, same kitchen. Once you prepare meals for them, make sure that everything's cleaned afterwards. But again, a lot of cleaning goes on in this case. Ideal world, somebody else can take care of them. That's not everybody's case. So if you can't have somebody else take care of them, then make sure you do what you can to stay clean and sanitary before you get to them, so you don't pass it on to them. Okay?
I'm really curious about the children getting this illness or this condition. If you're quarantining, how is this happening?
So the question is, how are children getting this PMIS, the pediatric multi-system inflammatory syndrome, especially if we're quarantining people that we know have coronavirus? Well, first and foremost, the people that quarantine are the ones that either have symptoms or tested positive. Remember, up to 50% of people with coronavirus won't even have symptoms of coronavirus. And so there are a lot of people out there passing it on without knowing they have it. Those are the people that we think these kids get involved with and end up getting coronavirus. Now, as far as why these children get it, nobody really knows why it's happening in particular. But what they think is happening is coronavirus gets into their body, they recover from coronavirus. Sometimes parents don't even know they had it because the symptoms are so mild. They recover from it, and then a few weeks later, up to 6 weeks later, they come down with this pediatric multi-system inflammatory syndrome, the PMIS. That they think is happening because when their immune system revs up to fight coronavirus, in some children it goes hyperactive. It can't calm back down once the coronavirus is taken care of. So it goes hyperactive. There's no coronavirus there to attack, so it starts attacking other parts of the body. In particular with this one, it's the heart muscle, which can lead to heart failure, and that's the big concern. So we're not exactly sure why that's happening, but we think this is part of the puzzle. Again, we're not even sure it is directly related to coronavirus. We think it is because the vast majority either tested positive with the COVID-19 test or tested positive with an antibody test showing that at some point they had coronavirus. So again, the bottom line here, everybody needs protected. We think kids have some protection, but that doesn't mean they're perfectly safe, so we need to protect them as well.
Is this issue with kids also? Could viral load be impacting that with the children?
So the question is, could the viral load be impacting that? It certainly makes sense that it could be. Again, there's a lot we don't know or don't understand here. But by viral load, what we mean is how much virus they get into their body. So if somebody coughs or sneezes on them, they can get a large amount of virus into their body. Kids are smaller, so we do know that in some instances, kids can handle a higher viral load than adults can. As a matter of fact, there was a study in Germany that looked at the amount of virus that a person had, and they found out that kids, especially kids without symptoms, had the same amount of virus, the same viral load as adults, and sometimes even more so. And so it seems like kids can, but there are certain kids that for some reason we don't quite know, when that viral load goes high, their immune system goes into overdrive, goes hyperactive receptors for coronavirus, meaning the coronavirus, once it comes in, the SARS-CoV-2, once it gets into the body, that virus, it attaches to receptors. Once it attaches to receptors, it gets inside the cell, it can start replicating, and then it comes out of that cell in abundance and starts moving to other cells, and that's how it builds up inside our body. The ear is different because the ear itself is a closed system. There's no mucous membrane in there. It's a closed system. Those cells aren't present in there, and there's no direct conduit into the body. That's why you can put ear drops in there. It's not going to go into the body. If you put eye drops in, nose drops, if you drink something, that all goes directly into the body. In the ear, it doesn't. So that's more of a system where it's covered with your skin and then your tympanic membrane, which is the eardrum, and that protects it from getting inside. So ear is not one way to get in there. Eyes, nose, and mouth are the main ways that gets into your body.
My daughter's pregnant and she works at a day camp. Should she be going to work?
So the question is, her daughter's pregnant, she worked at a day camp, should she be going to work? She should certainly make sure that she is safe at work, and that means finding out what they're doing to keep everybody safe, the people at the day camp, the participants, and the employees at the day camp. And usually that means a lot of cleaning, a lot of personal protective equipment, that PPE. As far as the pregnancy, it looks like at this point that pregnant women have the same risks and the same complications as everybody else. Doesn't necessarily pass on to the fetus, and we're not even sure that the fetus, up to now there's only been a couple cases of fetuses having it when they're born, when the baby is born, but for the majority of them, they seem to be as protective as adults and have the same chances of catching it and same complications. So from the pregnancy aspect, it's one of those things that consider more about the PPE, the personal protective equipment, and what you need to do to stay safe while you're at home or while you're at work. Same thing we talk about with anybody else. So again, these are all fantastic questions. The two headlines today, the Pediatric Multisystem Inflammatory Syndrome, PMIS, which is happening in a couple hundred children around the world, but we think there might be more cases out there, and we'll find out more now that people are keeping a detailed idea of what's going on and reporting that. So I think you'll see the numbers go up. But again, remember, it doesn't happen very often. The best thing you can do here is just keep your child safe, because we know they are somewhat protected from coronavirus, but not completely safe. And then the eyes. Studies are showing that the eyes are another way that you can get coronavirus into your body. That's something we knew, but now we know why that's happening. That's because of receptors inside the eye. So this is Monday, the start of the week. Again, we're going to see what happens with coronavirus as the week goes on. But the main thing is to stay safe. If you're in an area where it's a hot spot, still follow instructions as far as staying at home or staying safe at home, or pause, or whatever they're calling it. If you're in an area where they're letting you out more and more, follow those directions as well. Social distancing is still the key for everybody, whether you go out to eat, whether you're going to church, whether you're going anywhere else. So just be very, very careful with that, and make sure you have an understanding of what you need to do to keep yourself and your family safe. But have a safe week. Stay healthy. Thanks.